the deeper you get. Okay, so with Holly in this side lying position, she's really comfortable, but it means let's do arms and legs in this position too, and then we'll be able to show people that they won't be intimidated by, you know, 17 pillows and what to do. So if we grab a little oil, I think we're going to do at the same time, which is very classic that you have two people here. So if you want to do an arm and Rob the leg, we'll start with an effleurage first. So for the leg, the effleurage looks like this. We're going to go up. We're going to be pushing always up towards the heart with our pressure. We're going to go around the corner. We're going to go right up here. This time I'm going to move the bikini right up out of the way and kind of give her a bit of a wedgie there in the gluteal area. Then we glide back without pressure because those little veins have valves. They just want to open up towards the heart. Here in the arm, Hopi, we're going to go up like this around the corner and again push up and then glide back without pressure. Okay, so I'll let you folks look straight back. And it's nice when you're doing it the same is end up at the most proximal to the trunk at the same time, shoulder and hip, and then glide back around this. Then they don't get too scrambled. Great. So that's a really good momentum. Got a good eye on each other. How's their pressure, Holly?
Very similar, yeah.
Nice. This time we're going to have you stop here, and we're going to go around and around like we did on the tummy. Little tiny overhanded palmar kneadings. Yep, you can keep all the thumb and fingers together. Yep, and go all around. You've got a really nice generous surface here, so you can do the whole hip area, Rob. You've got a teeny weeny deltoid here, but that's okay. We're going to move into reinforced palmar. So then put one on top of the other like this and go round and round. So it's kind of like one stroke. Nice work. You've got a good touch. That's great. Rob's been massaging on his own. I haven't got to check his, appreciate the quality of his touch. That's wonderful.
Really good.
And you can get right around that deltoid, Hopi. So what we want to do, folks, is we want to open up the circulation to the extremity. So we focus on the hip and the shoulder first. So we've got this reinforced palmar kneading, the overhanded palmar kneading. Now, guess what this is called? Does anyone remember? The thumb work, overhanded thumb, whatever. Got a name for it? Alternate thumb kneading. Okay. So we're doing alternate thumb kneading. Again, we're pushing up and out, up and out. So what you do, Hopi, is you encompass the whole shoulder that way and you work all around the deltoid. And the same thing, Rob, you can have your hands that they go right out like that. Yeah. And just lead with the thumb. And that's very, very good for opening up everything in the hip and the shoulder so that the circulation for the rest of the arm and leg is running even better. Yep. And now the hard part for Holly is this outer aspect of the leg called the iliotibial band. So it comes from the ilium, goes right down here to the tibia, and this all the way down here is very, very tight on everybody, especially athletes. So we're going to encompass the extremity. I'll show you here, Hopi. So we're going to wrap our whole hand around, and you're going to massage up and down. And with this, you can get the biceps in the front. Let me get in your way here. You can go around and get the triceps in the back, okay? So you can do both sides. And with you, Rob, it's this right down the center here. The iliotibial band goes right around the corner. So go right from that tibial attachment right up to the ilium.
Christy, can you turn the heat off?
I can.
I just get so hot with everybody's
coming down. That's great. And push up and out and up and out. That's good. That's great.
This is awesome.
Is it working?
It's such a good move.
We have such a good team.
Yeah, that's great.
Nice work, everybody. And being able to wring the extremities is a really great feeling on the receiving end, but it's kind of awkward in terms of how we execute that stroke. So let me show you a wringing that's kind of like a thumb wringing, and you're going across like this. And let me show you the whole hand wringing that would be like that, where you can really wrap and wring like that. Well, let's get that covered. There you go. There you go. So you can do the wrap thing and you can do the thumb thing. And with you, Rob, same thing. You got that thumb stuff. And this is really good for stretching out that iliotibial band. And then when you want to go for the whole leg, just turn either that way or that way. And the whole thing here is to try and grip so that you get the hamstrings and the quads. And so whichever position works best for you to get way underneath there and grab them, just go for it and we'll get out of your way. And what we can do is we can move Holly's arm forward and then that'll give Rob more room.
So am I still comfortable with your arm up like that?
There you go. That's really good, Hopi. Yeah.
Am I just doing this on
Straight
the upper
across,
arm, or am
all
I
the
doing
way
this
up and
all the
down?
way down
No, we'll do just this section and then we'll go down to the next. Yeah. Yeah. Straight across, yeah. The grip and grab and ring is just such a good feeling from the receiving end.
It's not pinching your skin at all?
No, that's good.
And I think we'll do all the way down because that is a really good continuity that we're doing here. So you can go down the forearm. And if we can get a shot, Chris, of where Rob is able to get like right around here, it shows really well. And if you wrap your hands way underneath, Rob, and then take it real slow, then we can, yep. And so you can see it's easier for him to wrap one thumb back and then one alongside, and then you come right around that corner. And the lower aspect of the leg is really easy, right? That's a good fit, Rob? Yay. You look like you've been wringing Holly's legs forever. That's nice. Very good. Okay, so what we'll do now is I use that effleurage kind of in between, you know, to go into a new sequence. I'll go up and then I'd say all of this work. Now Rob's lower leg is always a big focus when somebody's pregnant. Do you know why?
The lower leg when somebody's
Yeah.
pregnant?
Yeah.
Maybe because of the weight it has to carry?
Yep. And then what would happen with other people but isn't happening with Holly?
With the lower leg?
Yep.
Cramps?
Yep.
Swelling?
And swelling.
Yeah.
Yeah, most
Water,
people
water.
are, exactly, most people are so puffy that this bump, their ankle bone doesn't even show.
Right.
And they can't get their boots on and all that kind of thing.
Yeah.
And you always want to be pregnant in the summer so you don't have to wear shoes. But Holly isn't like that. She might be retaining fluid, but we can't really tell. So being able to work the lower leg is still really important. So use the alternate thumb kneading and the ringing. So I would alternate thumb knead that aspect too. It's the same with the hands. People can't get their rings off and that sort of stuff. So if you guys do the lower aspects of the extremities at the same time, that would be good. So alternate thumb kneading is great. And with that one, we've got the pressure going towards the heart.
Right.
So I would, and her leg will move, and like you can have it in your hands
Oh, that's cool.
wherever is comfortable for you, because both hands will encompass it so that you don't have to have it in an awkward angle for you.
That feels good.
And this is always a great idea without leaving an oily footprint on your nice shirt, but that's perfect.
It's my massage shirt.
Okay, Holly, everyone should be having a baby with Rob. It just looks like,
But I'm sorry they're not allowed.
sorry.
There are some flaws.
He's got the perfect
Sorry.
touch for you. Good work. And that's great. And I would do lower because he's doing lower. You know, just
Okay.
keep it so that
So
the
just
two of
stay
you.
on the lower
Yeah, yeah. And I would take his lead, just watch where he is, and then keep your stroke. So if he's doing ankle, you're doing wrist, that kind of thing. It's an easy way to coordinate a team. Nice work, everybody.
So with the alternate thumb kneading, is it important to only be going upwards?
Yeah, yeah. Well, the pressure
the heart.
towards the heart, yeah.
Towards the heart, yeah.
Because there's these little valves in the veins, and they just want to open that way. And the trouble with lower extremity is hereditary factors will be issues. If Holly's mom or dad had varicose veins, then we would look for a disturbance. Usually it's a blueness and a a bubbling on the skin, and we'd work around that. So we wouldn't do anything that was going to try and smooth that out, or we'd be in trouble. That's great. Okay, now where it feels the best is the further down you go. So ankles, you could spend like a year at the ankles and the wrists, and it's so relaxing for the person. So often in labor and delivery, I actually spend a lot of time assigning people like do her feet, you know, when it's in between a contraction.
What about the sole?
Yeah, we'll get to that. But this is where
I think
things
I have to put my
tend to
leg
get
down just a little because my
your hip is going in?
I'm on my belly because it's just so
Okay.
big. There we go. But that position feels great. I just can't quite bring my knee way up.
We got it now?
Yeah, perfect.
Okay, good. And with this Hopi, I'll show you what I do. I tend to lift it up because that way I can bend the wrist and it exposes more of the,
Joint there.
yeah, so it's like that. And then you can work down there. And then when we do the palm, we'll go underneath like that. Okay, so I would do that top part. And then with you, Rob, with this, I'll tend to do both at the same time, both bumps. Like I'll do the upper bump and that underneath one at the same time, or alternate like that. And even though it's awkward, it feels really great from her end of things. Your hand might be a better fit than mine. But this thumb would go around that one.
Yeah. And this?
And the bottom,
gotcha.
yeah.
Yeah, gotcha.
Yep, so they're both going, yeah, that's lovely. Yeah. And I kind of get the foot rolling around with it, but it's like a slippery fish. That's good. Doesn't that feel great? And it doesn't look like there's hardly any attachment at all there, and yet it's just so relieving to get that ankle done. And everywhere you do, like the Achilles tendon and in there. Yep. And then that's just what I was going to suggest. If you do that ringing thing, it really feels good. Yep.
Down the wrist.
Exactly. And
Yeah,
with
okay.
Rob, he can ring right out the foot itself too, and it's a really nice fit. You go right around that corner and do the whole foot. Yep. There you go. Yep. Boy, you're good. Chris, this angle is so good. If Rob could keep doing that. That's great. And then if you slow it down a tad, there we go. How's that, Holly?
Nice.
That's great, Rob. Thank you. Okay, and then we get nitpicky like this. And we're doing that alternate thumb kneading. Now the trick is, everybody, when we get to the toes, we're going to corkscrew the toes outward. And we're going to do 2 in one direction. This middle one, it can go this way, or you switch hands and it can go that way. But the idea being is that you get the 2 outer ones going towards the outward aspect of the foot. So it's in those directions. There you go. And you really take it a little bit slower than I was doing, but you try and get your big hand around one toe at a time, which is just about, well, forget impossible. That looks really good. Yep. And then you come to the next toe. Yep. Little teeny toes. And that middle one, Rob, doesn't matter which way it's going to go. It can go that way or that way. But then you switch hands so that then these go that way. Yep. You got it. That's great. Thank you. And right down to the little finger and the little toe, it really makes a difference. Yep. And ultimately, you would do that 3 times, you know. And that,
round?
yep. And that really gives them a chance to. But we're going to cheat and move on to the next. We'll let our audience keep massaging those fingertips in a cork. And I call it corkscrewing because it really is a wraparound kind of movement. Okay, so Rob, then you can do the sole of the foot with your alternate thumb kneading like that. And same thing, Hopi, you can do the, I'll give that to you. And so with this, Chris, you
So
can...
the direction, the best thing to do this, the direction is towards that side? Or
Yeah,
out?
but you know what? When I do the feet, the very bottom, it doesn't matter quite as much.
Right.
Because there aren't any large veins there to mess up. So that kind of thing. And you can never do enough of what's underneath there. So this angle is good, Chris, and then right from over here is good. That way too. Yep. Yep, and you can lift, but what you're doing, Hopi, leaning on the table is good because it takes the pressure off your back, and then the way Rob sits down. Anytime you can sit down on the job or take the pressure off your back, because we're going to be massaging for hours. You know, like we would just do this continuously in between contractions. So wherever, okay, let's fake a contraction, okay? You ready, Holly?
I don't know how.
Don't worry, I'll tell you.
Okay.
Okay, so she's got one coming on, and what I do is I get anyone else who's on not to move their hands, right? So you can just stay holding on, but don't be massaging, okay? And we just stay steady, and I'll get you folks to practice this. So I'm leaning like this, right on the sacrum. Okay, just starting to come up now, and it's starting to bite. What you do is breathe deep and focus right in the center of that sensation, and just allow that uterus to really tighten up, give that baby a massage. You want a really big squeeze, so just let everything else drop away. Yep, just let everything drop right down from your nose to your toes. Nice breathing, just breathe right into that. And I'm just going to keep my pressure steady, and now I'm pressing with all I've got, and it's peaking, and it's just coming down the other side now. That contraction's starting to ease off. Just keep the breathing nice and big and slow, and nice deep, deep, deep breath. That's it. Okay, and we're just about out of that contraction, so it's gone now. And even though there's nothing remaining, I want you to do one more deep breath. Good, 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 great. Okay, and then I just ease up my pressure, and then I kind of massage away the imprint, you know. The other thing is, if I'm, you know, working away there, I just do a light release stroke, and I do that until she can't feel where my hand was. So and the back is always more stimulating than the palmar aspect. So that like a caress, that light release stroke, the reflex stroking, will make it that she can't feel where I was pressing. Is that right, Holly?
Yes.
Okay, so and then you move on, and you just, while she's got the 4 minutes or whatever, you just keep massaging wherever you were. And then when she goes, okay, here comes one, someone comes around here and does this, okay? So Rob, do you want to practice that? So we got another one coming, Holly?
Yep, definitely. This
Okay.
is a big one.
Good, okay. And you can do this kind of angle, Rob, and I'll check your plant, yeah. And put one on top of the other, but use the whole palmar surface, yeah. And you're right on it. Now I would get it so you're more at a diagonal there. You got it, that's it. And the way you've bent in there is perfect. But don't use it all right away. Okay, and now it's coming up, so we've got more and more pressure on the inside. Deep breathing, Holly. Keep the breath nice and steady. Yep, and just open your eyes. Look at me as you're breathing. Okay, that's good. Focus right on me and breathe. Okay, good, good, good. Okay, and now it's right at the bite. It's at its highest. Keep looking at me and just focus on that sensation and breathe into it. Breathe right into it. Rob's got lots of pressure there to counteract, and then it's coming down now. But stay with me and just breathe. Nice deep breaths. Good focus, good focus. Okay, and you can just ease up a little bit, Rob. Keep your eyes open. Yep, we're right at the end there. It's gone. And then another deep breath. And then you can just close your eyes and just go way, way down. Just have a little nap. And then use that reflex stroking, Rob. And it's really, really light. And the lighter you go, the quicker it'll erase. And I would go across also and use the back of your hand. Yeah, and it's not even a ringing. I'll show you. It's like this.
Okay.
It's really, really light.
Like
Yeah,
a feather.
yeah, that's it. I would go lighter and lighter.
Yeah.
Yeah,
Yeah.
and then lift off. Is that erased? Good. But yeah, and the trick is to erase it, because I've been in situations where they go, I can't take it anymore, and then we're on ice, you know, because I forgot to kind of keep erasing myself as I went. And then we would just keep massaging. So that's how she kind of gets massaged the entire time.
Should I have like bagged the ice ready?
Yeah.
I should.
Yeah,
Because
because
it can go from hot to cold.
Yeah, and also we want to kind of do everything we can to make that accessible so we can keep pressing on it. So now I use ice therapeutically, and I'd stuff a little ice in her underwear or bikini or whatever, you know, and then we can keep going. Okay, Holly, do you think that we could try a little bit of face up now?
Okay, we'll give it a shot.
We're gonna give it a shot. Okay, so I'm gonna do everything up right away. So if you get that one, Rob, if you can get this one, and you can get this one, Hopi. And this is a classic, folks, that if you've got someone who is in the last 2 weeks, keep moving your massage. We might do sideline with you, Holly, for 20 minutes, then we might put you back up again. Then also to turn on the other side. So for instance, when I did
Because I did start feeling a bit of pressure in my chest, in my heart actually, from so much compression.
Okay, you know what? Let's show the sideline for doing that stuff before we get her over. Okay, so what we were doing before with the rib raking, Hopi, can you show some of that rib raking that we did in the sideline position? And she's going to reach right for that costal edge here, the angle. Yeah. And look at the shape of Hopi's fingers. That's right. And you get that grip. Okay, and as soon as you get around the top, then reach with your other hand, Hopi. And I think a nice long shot shows it good too. Yeah. And that grip. And that advantage is that intercostal space and those teeny weeny fingers are a good fit, right? You've got these big little frog paws there with like big
little?
Yeah, because it's like you want to have them in there, but okay. And so Rob, take a try and get your fan out of here.
Try.
She liked you.
So what am I doing?
Yeah, if you follow Hopi there, and she's got such a diagonal coming this way that you'll have to get right up where we are here
Very slanted
and pull
ribs.
back.
The pressure is medium or?
How's the pressure,
Good,
Holly?
medium, yeah, and it's
Is
good.
that good?
That's good.
Okay.
You don't want to do it too.
Actually, you want to get quite a grip
Oh, okay.
because we want
Like
to do
a
everything we can to ease up her breathing. That's nice. How's that, Holly?
You could probably go just a little bit more.
Okay, then what to do? Just slow it down and a little bit more on the tips. There.
Yeah.
That looks good. And pull. Keep it moving.
Sophie
That's
is,
great.
is nibbling on my teeth. Or my teeth, on my, on my
I want to
toes.
just go down under there and that will explain what is happening here. Thanks, Chris. Okay, and then I'm going to get in there for the exam and see if everyone was doing it the right way. Any difference there?
Your pressure is a bit more, well, yeah, actually substantially more.
Okay. So what, and is it uncomfortable?
Well,
Should I ease up?
no, I think it's just right on that border.
Okay.
Because I feel really compressed in there, so I think it's
Okay.
opening it.
And now the other thing is every lift. So what we were doing was just doing everything we could just to lift things up
Oh, yeah,
here.
that's good.
And this, we discovered when we did Holly's breast massage that any of the uplifting strokes work.
Yeah.
So Holly, I'm going to get you to put this arm above on your ear in a way. Okay, so just that resting here will lengthen this, and right away, try your arm above your head. As soon as you do that, it changes your breathing thing. So it's really easy to get that. So I would try again, Rob, see if you can duplicate me, and make it a longer stroke. Because remember, those ribs are going to wrap right around the back there. Yeah, that's better. Yep, and same thing, Hopi. You can get in there and take a turn. But you guys are getting the right idea. Keep it going right around the back. Yep, nice. Good.
Yeah, you can feel the ribs a lot easier.
Yeah. Mm-hmm. So this is really important to be able to get, and you can see also the angle here of this is the edge, and that's where this baby is sitting up high, but we're hoping that it will take a drop any day now and give her more opportunity to breathe easy. But because of this angle, I'll show you our other stroke that we do from the side. And this is the same, Holly, when someone's palliative and they can't move. I use this same side approach. So I'm going to come and use the ulnar border of my hand, and I'm going to get right under there. So far so good? Okay, and I'm going to go right around like that. And then I can take this one and chase it, just because I tend to do one and then the other, but you could just do one. You could just go like that and follow. Now your hand will take up a lot more space than mine, Rob, but I would put another reassuring hand here, and then it gives you a balance. Yeah. And can he slice a bit more in?
Yeah, I couldn't tell if that was him or you.
Oh, that's nice. Very good.
Yeah.
Yay. Okay, Holly, let's see if she can tell when you're going to change. Okay, Hopi, in you go. Probably she can tell by temperature. How's that?
Good.
Same
Yeah.
pressure?
I think just more fingertips is the difference with you.
More fingertips.
Oh, were you? No. Oh, you're on the edge down here. Okay.
Yeah.
Maybe just a little more pressure then was what it was, but
So you kind of want to be up and under
even
there.
though that's kind of a sore spot, but
Because you get into the
Does it feel
floaters
okay?
there.
yeah, it does. It's the right place for sure.
And the last thing I do is this, which, you know, she won't be able to tolerate a lot when she's face up, but we're going along that edge. So you can feel where the edge is the whole time, but we're doing a single-handed fingertip kneading. How's that, Holly?
Good.
Does that seem like a good stroke to
Yeah,
add
it's
in?
a good stroke.
Okay.
I feel a lot of soreness just
Okay.
right through there.
So when there is soreness, that can be the baby pull kind of soreness. And don't be afraid just to slow it right down and ease up that soreness. So hope you try that. One hand here, and then I'll get Rob to follow in after you. So yep, come where I am. So you're more at an angle there. Yep. And it's right on the edge. So you're flipping on and
I'm
off.
trying to use all of my
You know, I
fingertips.
mostly use these ones, and it's a bit more angle edge. Like have it, let me take your fingers. So it's a bit more like that, right? And if you just slow it right down, you have more control. Do you feel that? That's good. And you've got that right
And I'm
rotation
pushing
to the
up
wrist.
against the ribs.
Yeah, lovely. That looks really good. And try it again right from, so you go way down there so you're out of sight. Yep. Then you hook on. Yep. Now we're making it look easy, Rob, because we got little miniature hands here. But this is probably one of the things I'd say for the next 2 weeks I would keep doing. And because she spends a lot of time on her side, she's easy access for
Did
this
you
sort of
say
thing.
not to do this when she's in labor?
No, we do everything, anything and everything. It just doesn't come up as much in labor as it does during the last 2 weeks of the gestation, where it's just everything's so big and pushing. There you go. So Rob, if you step in, and same thing, start here with
Yeah.
one hand way up there. Yep. And then, and then right along there. And then if you lift this part up, so it's just the fingertips, and then put a hand there, and I back right up where I was there in your place. I go
Christine,
further back.
Can I have
Yep.
a little coconut oil? My lips are so dry. I'm sorry.
Yep. Coming right up. And is that pointed enough, what Rob is doing?
I think so.
Okay, you would know.
It's a little hard for me to judge just because I have this major discomfort, so I'm trying to
Okay.
decide. Like,
And the
is it-
major discomfort here, is it
It's just-
pressure or
It's
is it
sore.
here?
It's just from there to there, from where
Okay.
those 2 points. It's just very sore.
Okay. So let me just see if we're a little slower here, like actually really slow. Does that seem to have a relieving quality
It's a
to it?
yeah, it's better.
Yeah.
It's still just this strangely
Okay.
tender spot.
And again, I would alternate with this kind of overhanded lifting, and then that fingertip, and just go really slow. Yeah, and I put the other hand up. Yep. How's that?
That's better.
Because this might identify itself as something that does come up, Rob, in the next 2 weeks. You know, because it's amazing as that baby drops too, all sorts of new aches and pains come up that
Great.
we'll just handle as we go. Nice. You got such great movement.
Yeah, she's got a really good deal.
It's a great deal. Okay, great. Okay, in this position, say we couldn't get Holly into a more comfortable position than sideline, then I'll show you, Chris, if you want to come around here, for working her neck, this kind of thing. So I put one hand here, then this one is kind of like coming up against this ridge right there. So I push in and up and in and up. And you might want to get it from Rob's angle too there. And then I'll let you guys try it. But this is the kind of finale. So I kind of do this, I call it piano playing, you know. I walk along with my fingertips there, but I'm always lifting up. So it's a lift up under that ridge, but I move it. So I'm over here by the mastoid process, and then I'm back here right in the center. And of course, say she couldn't move to other side, Rob. Say this is it, for some reason she just wants to be on one side. You get right underneath there. So then I'm kind of pushing down against and lifting up like that. Okay, so Rob, do you want to come in behind me here and try it? And the one hand here is a really good stabilizer. Yep. And lift it up that way. Try. Let me give you a different direction like that. And so what you do is you bend the tip.
These fingers are totally in the right spot. And
Yeah. And then
this
just
hand a little
bend the
different,
tip.
but-
Oh, okay. Put that way. Yeah.
But I think because
And I back up and I let my arm rest on the table. Very
That's
nice.
great. That's
yeah,
awesome.
that's perfect. And this kind of posture that Rob is doing is perfect because all the body weight is on his arms. And that's what you want. You want that kind of pressure here, and then his back can't mess up. But as we're finishing up Holly's massage, remember for your timing, this is the person that we want to make sure we get hands on. So Rob is the team player that's got to be cheerful or else we're in big trouble. So we do his shoulders and make sure that always in the coming and going, if ever there's a family member and a partner around, we do them, even if it's 5 minutes.
And just a little slower. Oh, that's good.
Good feedback, Holly. She's got the tactile feedback. That's very nice. And I'm going to let Hopi have a go at it. So it looks like you've cleared everything up there, Rob. And remember, even though your fingers are little, you can still walk along there. And I would do the same thing as Rob. I would lean back and I'd really work up there. Let me take you for a ride.
Sure.
Okay, put your fingers on mine. Okay, and so I kind of do this. I get going a little fast myself, but, and if you can get a shot here, Chris, also about how I'm showing Hopi what to do, because if people can learn to get right up against the student and put that, so if we can get a long shot too of just how, so I've got my arm down here on the pillow, right? So you can actually press, that's it, and then it lifts. You can feel how that press down lifts up. There you go. Yeah. There you go. And then try that. Yeah. And you can really pull up into the back like that. So you can feel how it goes under and up. Yeah. Yeah. But the trick you have to be careful of is don't pull.
Don't pull
So
hair?
hook on and then move to a new spot and hook on. But don't
Okay.
pull the hair. Yeah. There you go. And try the other direction. Okay? Up and under. Try that way. There you go. Yeah. It seems to be more of a lift when you do that. Yeah, and slow it down. And then tip it up. And you might just be a little careful because of your fingernails. But how's that?
Great, yeah.
Great. And then try the piano thing. Like move it along and do it. Yeah. 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 Nice. How's the pressure, Holly?
Great.
Great. Looks good, Hopi. Yay. Okay, and now the messy hairdo. So it looks like this.
But so for the bottom,
Yes.
you get right under there?
Yes, you do.
And you kind of push up?
Yes,
Oh,
get
yeah,
under
that's
there,
good.
and then you got it. Yeah. And I kind of keep them stiffish in the sense that I'll show you. I get here and I press down. Oh, let me get you back a bit here on the edge. Okay, so I'm pressing this part down like that and lifting up. And then it's just tips.
Right.
Tips, yep. That's good. How's that, Holly?
Good.
Yay. That's good. I think you've got confidence there, right?
Yeah.
Feels like it.
Yeah, yeah.
Okay, then what we do, again, instead of going back and forth on the scalp, hook on like this.
Love it.
And usually people with an abundance of hair like Holly, they do like this. But even if we didn't have such a head of hair, this is probably one of the #1 places where you can make everything relax. So after that kind of a workout, you know,
Yeah.
then this is really good. But get a good grip, big grip, claw-like grip. There you go. Yeah.
Yeah.
And is that the same as mine?
Yeah.
Good, 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 good. Great. Yay. Okay, and then we can let Rob in there for the finishing touch. And this scalp stuff is what we can assign people to when she's in between contractions, Rob. Like if we had, say, 3 people, we would have someone there, someone leg, arm. They could all be massaging, kind of like a group meditative massage. But it really is great to get all of the tension out, completely out, in between the contraction. Then when they come to pushing, we don't know how long pushing is, but they've got all their reserve
Really
of
firm.
strength for pushing. So it's just moving it. So if you get a grip in one place, then move it to the next, then move it to the next. Yep, that's good. Good work, great. Okay, so we're gonna try another face up, Holly.